real quick and introduce yourselves to our visitors. I'm Mary Ann Chivik. I'm the case manager here in the neonatal unit.
I'm Mary Tillum. I'm the neonatologist in the unit right now.
I'm Rasa, the social worker in neonatal.
Marilyn Feiner from audiology.
Katie Hardy from audiology.
Elaine Trulis, nurse manager. Thank you.
Yes.
I'm Dana Potato from occupational therapy here on the unit.
Samantha from speech therapy.
I'm Dee. I'm the respiratory coordinator.
I'm Ruth Jambeska, and I am the chaplain.
I'm Laura Vargas. I'm the NICU fellow.
Okay, so I know you just started, Laura, so go ahead.
Okay. So Jennifer Khan is 80 days, 38 and 3. 2.92 kilograms. He's on his feedings. Meal cake 27 calories. 50 cc's Q3 plus the rice cereal. Remember POs, which is about 30% of the time. Obviously, Lumiere still had a couple of birdies with feedings yesterday and one Brady piece at breast. His medications are all unchanged. His bilirubin is stable, which is 6 today. His albumin is getting better slowly, but it's increased from last time. Really, we're just working on his POPs, and this is a mom that, again, we talked about it last week. Last week, about Friday or Thursday, she came to visit, so I went there, and then she said, oh, well, you had mentioned something about the NGPs. So I said, oh, well, good that you bring it up, She said, yeah, I think I might want to try it and see how it goes. And I said, that's perfect, starting Monday, you can call and try to learn to place the tube and do all these things, and then she wanted to do it. So now the issue is, then she said, oh, but then I needed you to write me a letter because I need to go back to school. And then I said, okay, so then when she said she's going back to school, I said, oh, okay, so who else is that, at home that can help you with the babies? And then she said, well, no, him, which is the father of the baby, sitting there, which is the boyfriend, but she doesn't live with him. So,
And Grandma works.
And Grandma works. And I don't know who else is in the house, because, she didn't say anybody else.
What the plan was with the little girl before all this came up. Did they have daycare at school that she was going to bring this baby? He is not a daycare candidate.
Or can she do a homeschool plan?
It depends. We probably need a staff member get her in and have a meeting.
Because I'm a little concerned how this 17-year-old is going to go to school full time and take care of twins, one with an NG and 5 medications.
I'll coordinate.
I don't know how she's going to do it. I couldn't do it.
Yeah, we'll get her in
whatever,
for a meeting.
because it sounds like, Dad is like, oh yeah, he's gonna be helping, and I'm like, oh, so how's your work schedule? Is it pretty flexible that you can? And then he was like, so I'm like, maybe he doesn't have a stable job or whatever, just volunteer information.
It's admirable that she wants to learn. It's not that I don't think she could do it, because teenagers notoriously
They do better. Right.
But she's got a lot on her plate, and it's not just one baby; it's 2. And then full-time high school is a full-time job.
So what days are good for you if we plan for a meeting with the family?
This week, any day but Thursday. I will call Thursday.
I'll set something up and I'll let you know.
I will be here every other afternoon.
Okay, so we'll plan on meeting with the family, because now we've been holding off, but Jeffrey is closer to term now.
So he's 38.
Yeah, and he's better with the sick and feeds, but he still doesn't take it all.
A lot. I don't know if
he's not dying quite as often.
anything else to be
His son Friday found today he did much better.
He did
with all the
much
good
better.
feeds, but he's still just fatigued, and you can't make him eat if he's not going to eat. But he didn't have any episodes, so it's good. So we'll see.
I don't know. It's just...
All right. Well, we'll meet with Mom and go from there.
Okay. The next one for Nas, Yama. On the 25 days, 34 and 4, 2.26 kilograms. He's on breast milk, human milk fortifier, 42 Q3. He POs about 33% on Lumiere. He's been off of caffeine for 8 days, only on vitamins. And So he's just learning to PO. He's 34 and a half weeks, and this is the mom that she doesn't want to go with NG anymore. She just wants to wait. And he's only 34 weeks.
Yeah,
so
I know
think she's
initially
waiting.
she was interested, and then her husband was nervous,
Yeah.
so then she decided not to.
Yeah.
Because I know Jeanette worked with the family, and Gina Smith you have as the pediatrician for the family. So
Even on
Just
Friday,
before it
interestingly, the
was
mom
before.
had told us she didn't want to do it, and then Jeanette came in to do teaching. And Jeanette's like, well, I just called the mom, and she said she was going to meet me here for teaching. I said, well, she told us she doesn't want to do it.
Yeah.
So she was supposed to talk to her, and as far as I know, she
yeah, I
does not
haven't
want
heard
to do it.
anything.
No. I was to talk
She
to her.
may
and
change her
said-
mind in a week or two.
Yeah, but maybe in a week or two he'll better.
Yeah.
Exactly.
Yeah.
Who knows? So,
Okay.
So otherwise he's fine. The Benson twins went to Morris this morning. So Bilal
It was
Richardson.
very nice how you got them turned around so fast.
Oh, thank you. Those work for me.
Richardson, 28 days, 37 weeks, 2.7 kilograms on his progesterone, 50-3, POing 40%, and having few episodes of speeding up, a couple of small emesis a day, room air, no events, and vitamins. So because it's been kind of like persistent complaint with his emesis and speeding up, so we're going to try this Zantac. It's going to be just a trial, 3 days or 4, and see if it improves. If not, then we'll just stop it.
And this is the family that wants to follow with Sean Cahill and me. I had heard something too that this mom might be interested in NGPO, but I haven't followed up
She
with her.
said no at the bedside.
Okay.
Yeah. Talk to her
She
Friday.
may feel differently in another week or two if he's not eating, but
Yeah. All right.
she's
Yeah.
nervous.
They're all taking their time. They're taking home and energy. So. Robert Janowski, from 19, 12 days, 35 and 5, 2.85 kilograms. He's on full feeds now, all energy. Was on a high flow thing about 3 liters. Room air, no medications really. Really with him, we're just waiting the oxygen. We're gonna try to see if he POs anything, and he's mainly we're just waiting for the labs that we send out. And one is we're actually sending today one for the Smith family opens is the cholesterol, and we send the other one
The
very long chain
chain
fatty
fatty
acids for the Zellweger. So those might take
And the repeat chromosomes with the 22q level is pending. So
Yeah.
he does have Dandy Walker on
Is it
MRI.
there?
The rest of his MRI is supposedly normal, and his spine is normal. So I don't know where he's going
Is
to
he
fall
still
on the
real-
Dandy Walker spectrum, but he's still very floppy.
Real fun.
Yeah.
So
How's this family doing?
They're
You've talked to
They're doing okay.
Yeah, they are.
They're staying at Ronald
They're
McDonald.
coping admirably,
Yeah, they are.
considering we keep telling them every day, we're waiting, we're waiting, we're
It's a
waiting,
young
we're
couple.
waiting.
They're very good, very involved. Yeah.
Would he
very
benefit
good.
from orders for us, or is he ready yet for OTP?
Oh, he's very stable. We could have orders for him.
Yeah.
And we haven't even started PO on him, so you may hear from us in the future, but we haven't even started
Give it a
yet.
try.
Yeah. Most likely you will.
He's been breathing so fast, up until now, we haven't been able to try, but now we're finally getting to the point where we can try.
See someone if in the real long-term future, if he doesn't take off with PO feeding, you'll talk to the family about it, you too.
Oh, yeah, but I think we gotta at least try PO
Yeah.
first before we do move to a D2.
Yeah.
Okay.
Now, if he ends up having one of these really bad diagnoses, that may change. You know, if he ends up having a Zellweger or something,
Yeah.
they may be willing to put a peg in or something, depending on how he's ever going to eat, but we'll see. Carrie's
Yeah.
not sure what she has. What he has.
Okay. And I don't know about like PED support, like if it's a bad diagnosis, like hospice out there. I don't know what kind of
Some of them
resources
have,
are out
like,
in Morris.
Survival of 6 months or something.
I would have to look at it.
We'll see. Next week,
But we don't know.
We should know.
Yeah.
We don't know what it is. We don't even know what he has yet.
Hopefully not.
Yeah,
And
hopefully we don't
we've
need
told
those.
Mom that everything is pending, but we have not told her, oh, he could have this horrible thing that he's going to die from. We're going to wait and see what kind of diagnosis we come up with, and then we'll talk to her. She's had enough bad news
Yeah.
in the last 2 weeks. Poor soul.
All right. Toby Blaha, 37 days, 37 and 2, 3.04 kilograms, few updates, and also breastfeeding. Lumiere on amoxicillin, caffeine restarted since Friday. The sleep studies showed central and obstructive apnea, so that's the reason for it. And he also, his other problem is high blood pressure. He started having over the weekend. It was actually kind of trending up, and it just got over, 100 consistently over the weekend. So he had a LASIK renal scan done today, and we're waiting for those results. I saw the pictures on the computer. They look nice.
Yeah, I'm mixed feelings about this. Agrawal's out of town, and Aronson says, well, he can go home, but he needs the scan. Well, it's like, are you treating it? Are you not treating it? Am I just watching it and hoping it gets better? Or so, I mean, home nursing may have to do some blood pressures at home.
Okay.
But once we kind of see what the scan shows and whether or not we can send him home, we'll see. But he's going to need closed valve. They don't have a chance. They're not going to have a way to do blood pressures themselves.
Right. So unless I get a digital blood pressure machine in the home,
Like baby one?
Yeah.
Oh, well, that's cool.
Yeah. So I can order that for them.
Yeah, maybe
He
probably
wouldn't surprise me if he would need it. Just because he's got bad kidneys, so maybe
Yes.
probably.
I probably once a year or once every 2 years I need to order a BP machine at home, but they do have them.
Okay.
So you want me? He's already set up for monitors. He's
2 o'clock.
yeah. So he could be home already, and I'll get the machine sent home
Yeah.
if you want to go
And
ahead.
if the LASIK renal scan, if Aronson is happy with that, I don't see any reason why he can't go home if he's not going to do anything for him anyway, except just follow him. But
I know Dr. Agrawal likes blood pressure.
There's like 112. Maybe it's just,
is it just a matter of mom putting the cuff on properly? It's not. Right.
Sure. Putting the cuff on and pushing the button. All right, so I'll set that up.
Alright.
So today or tomorrow?
That's my hope.
Yeah.
Unless there's something horrible on. The reason I don't want to send him home without knowing what the scan shows is what if he's a bad obstruction? Are they planning to do something about it? Because if they're going to stent him or if they're going to do surgery, is there any reason to send him home?
Who's this pediatrician?
It's the one who helped me decided.
Oh, correct.
So he's really.
I have copies for you. I'll give them out.
So we'll get him home.
So you, that's this.
And Amelia will be his home care nurse.
Radio, it's 24, 4 days old, 34 to 4, 1.76 kilograms. Weight. It's on Lumiere, no medications. Also PPN in advancing feedings, which she will be up to 2 days up tomorrow. Really nothing. Matthew Pacelli, 37 days, 37.2, 3.25. He's on, we're transitioning him to the bolus feedings. He'll be up to 57 Q3 today. He's on Lumiere. He has some DSATs and brady's and feedings, but, at the same time, we're just kind of like working him up to his whole feeds and transitioning. So he's on Zantac, vitamins and iron.
And he's not close, like his family. How much PO is he taking?
No, he doesn't they said he peeled a total of 50, but that's in the whole day. So he doesn't peel 2 feet.
480.
Of 400 something. So it's not, you know.
Is it oral aversion, Downs, both?
Well, inexperience for one. The poor
Yeah.
soul hasn't really.
It's not a mercy. Nobody.
He loves his pacifier. I think he just hasn't had a lot of chance. He actually has really good tone for Downs.
Do you see him, Damon?
Yes, I do. He does look really good for Down state, premature Down baby.
So I'd like to kind of see. I'm not sure exactly what he's going to end up going home on. He's had some stooling issues, and we went to switch from fortifier to progesterone, and then we tried giving the feeds over an hour, and he stooled out, and then we had to go back down again, and now we're just getting to the point. We did it over 2 hours, and now it's just today going to try over an hour again. So I don't know if he's going to need a pump at home, or if he's going to eventually reach bolus. Who is that for? For you?
I don't know. No, the 41 is for Karen.
So I don't know exactly what his needs are going to be yet.
And Nelson is a new one, just one this morning, like 1 in the morning. 32 weeker, 1.48 kilograms. From mom, G2P01, a former, I think a previous 32-week infant that was here in the unit.
How long ago?
I don't know.
3 years ago.
3 years ago.
Nobody remembers.
Mom came in and had ruptured membranes at home, and then started laboring, so they did a C-section for repeat. C-section, baby, she looks really good. She's unmarried. She's never needed any. It was just kind of like transition. Of course, we're 6 and 9, 6 or 8, 6, 8, and 9. So she's on 48 hours of antibiotics, and she's going to start slow feeding, just dropping feeds today.
This family lives in Frankfurt. Were they transferred from anywhere?
I think she delivered here.
I know she delivered
I
here,
think she was a high risk because of
like
her
she probably
bicornuate
saw
uterus.
people at Homer Glen and ended up here, because MFM has a clinic in Homer Glen.
Maybe, but I think they specifically came for MFM because of her high-risk history.
Okay. But they might need a Ronald McDonald House referral just because they're in Frankfurt.
Krupa, Maya Krupa is 8 days old, 29 and 1.34 kilograms. She's MPO, obviously on a PTM. Her vent settings, which have been stable, 38%, FiO2. Still in some dopamine, 12, which was at a size 20 over the weekend, mainly. Fentanyl amphotericin for congenital candidemia, and triple antibiotics for that perforation, spontaneous perforation. Well, not so spontaneous due to candida perforation. So
Mom's
she's really
placenta also grew candida.
So it's not a line infection.
No. Yeah, because she got it like the second day. She was already with the rash and everything. The third day. So really with her, just kind of like she has exploratory lab on Saturday, and they resected only 2 centimeters of ileum, the ileostomy, but otherwise it seems like everything else looked fine. So
And she has a valve.
everything.
How's the family today?
I haven't seen her yet today.
I've been out there.
This was the stress family over the weekend. Well, they're fairly close. They live in Westmont, so they're not so far from here.
They haven't been here.
Calming down. Their OB called today, and I told him the situation, and he was going to call them.
Who's their OB?
SVCV.
Yeah, I know.
SVCV. It's the only way I can
My
remember.
goodness.
No.
She'll be here.
Yeah. And then the next one, also self, 141, 20 days, 3306, 2.36. NCO, RTPN, still on the bench. On triple antibiotics for 5 days out of 14, probably for neck. Fentanyl, and some insect on the TPN. This is another one.
Did he get drains or
14 days.
nothing?
He never perked pneumatosis on the first X-rays and nonsense.
And he's not acidotic, he's not thrombocytopenic, he's no longer neutropenic.
And what's his family like? Have you met them?
Yeah, they're as big around the valley.
They're, mom is appropriate and tearful, dad is stoic. I think they were especially frustrated because he was getting close to going home. And I think it was just, it hit him like a ton of bricks out of nowhere. Nice little healthy family. But he had a very nice weekend. He's very stable. Hopefully,
But for the electricity now, he just has
that should be a temporary problem.
So we'll see.
So this is the kind of family who would probably want to go back then if he starts to recover.
Maybe. But I would want to make sure from a surgical standpoint there isn't any strictures or anything anywhere. So
he doesn't have to come back.
yeah. All right. That would be harder on them than just
Before you
staying.
break up, could I just ask our visitors from Taiwan if they want to ask you any questions?
Okay.
So feel free.
This multidiscipline is once a week.
Yes, once a week.
And all discussion note is another note or in the chart.
Yes, we documented in the chart.
Oh.
Who does, Miriam?
I do.
Okay, so the case manager documents the discussion in the chart.
In the nurse note.
In the progress note.
Of primary school. You are the team leader.
Case manager.
Okay.
It looks like the physicians run the meeting, is that correct?
Mhm.
Yeah, because that's what it looks like to me.
They present the patient.
She is a physician or nurse practitioner.
She's a neonatal fellow.
Oh, fellow.
Physician in training to be a
She's a
technologist.
Okay.
记录什么哪里？那个记录，看一下记录吗？
You are different from nurse manager.
Yes.
Okay. Yeah. And you manage all the case in neonatal.
Yes.
Okay.
So if you just, I was going to go over more what I do in the unit, so the rest of the team can go back to taking patients.
Thank you very much.
Thank you.
Sorry,
Thank you.
So any day but I'll try to do it. Can you stay here for a minute, Ron? Sure. Nice to join you. Eileen. Take care. You can come work.
Bye-bye.
Yeah.
Thank you.
主任那一份是我给的，那一份帮我拿过来，我的那是上面。
That's your goal for Nancy, yes, she does, yeah. It's for Nancy.
I think she probably
Okay.
I'll go get it. Hang on, I'll bring one of those for you.
With my population, with the population that we have here in the neonatal unit, they're either very tiny,
很小很小，他们的病人。
or they're just premature, or they are born with medical problems,
生出来
birth
的问题了
defects.，
生出来有
And sometimes there are social concerns regarding discharge. If it's a teenage mother, if it's a family that doesn't speak
可能
English.
出去之后有家庭有问题的，可能一些母亲她年轻，或者出去就直接请。
So when I document for the medical record every week, that's the group my patients fall into. And then I also try to list in the second half of the note who was at the meeting.
谁在那个开会？
So I've made it a series of check-off boxes just to
他也
make it
会
easier for writing.
会写下谁开会。
The sections where I have other listed is where I go into more of a narrative note and discuss more of the problems that we
另外一方
specifically
面呢，写的
discuss
清楚一点，写的提示一点，写
about
上
the patient.
他这个病人的状况。
A baby who was just born today,
有一个baby 今天刚出生，
I might not have a lot to document about.
这个不会写很多东西了，今天才生。
But in the case of the baby with the twin at home and the teen mother who's trying to go back to school,
另外一个呢，就是一个年轻的妈妈，家里也有一对了，已经有
I
回
have
家
to go into more detail for the teen.
那就要尝试一点讨论那个问题了。
So as a group, we meet once a week.
一个礼拜一次聚会。
And that's because with the population of patients in the neonatal unit, we measure their stay in terms of weeks or months
他
instead
楼
of
在这边的
days.
病人，我们不是看楼多少天，这个楼多少礼拜、多少个月这样子。
And so it's convenient for us to meet as a group once a week.
所以他们够了，一个礼拜一次聚
I
会就
know
够了。
other services meet more often, once a day, twice a
其
day.
他的地方就一天，可能一天一次啊，比较多，聚在一起。
But this is the format that works in this area that we work in.
在这边就是一个礼拜一次。
So this is, for the patients, I think this for me is probably the most important. I plan my vacations around this meeting.
他是尽量不会这个时候放假的，开会，他知道开会他不会放假。
Because in some ways this sets the tone for what the plan will be for the rest of the week for the
蛮重
patient.
要的，因为开这个会，您就知道下个礼拜这个病人应该怎么样对付。
And I try to make sure that the note is in the progress notes so that everybody who was at the meeting or who wasn't at the meeting can look in the medical record and have access.
每个人开会的都会看到他的档案啊，要是没有开会的也会看到开会这样。
And have idea what the plan is.
所以他们会知道他们计划对那个病人的计划是怎么样。
So that's why when Paula asked me to have you come to the unit, this is the time I asked that you come so you could see the process, what the process looks like in our unit.
所以最好的 Paula 计划你们来看的话，就是看着他们开会是最好的。
When I was at the presentation on Thursday,
星期四他跟你们讲。
I noticed there was some question too about what the nurse does as a case manager and what social work does. Raza is the social worker in the
不同
unit.
的职位做不同的事，他是社工。
And we work together for the patients and the families.
他们都一块工作的，为了病人，为了病人的家人。
Usually when I try to explain what it is that I do for families, I work with the private insurance.
他所做的包括有保险。
I answer any questions about the infant's medical condition,
小孩子
clinical
的
condition.
的病例。
And Raza deals with the public insurance.
他是外面的 public, you mean government
We have,
insurance,
like Medicaid.
Okay. 他主要是美国政府的保助，同人保助方面的，他社工。
If families, we have many families that are here that are uninsured, don't have the private insurance
很多病人在这边是没有保险的，
or public aid.
可能是政府保助的呢，也有。
So we make sure that the families, that the babies also, we have patient financial services here at the hospital. So I always refer many of our parents and families to them, and we together ensure that the baby has some type of coverage, if not through the private, then through Medicaid.
他会帮助他找一些保险去保那个小孩子，没有一般的保险的话，就在政府里面给他保险。
And then if there's also, we're very knowledgeable of many of the financial programs in the community. There's a program called Social Security Disability, which is a common program for premature babies when they're very low birth weight.
Social Security disability 也有政府的保助的
It's a federal
Financial benefits
Yeah.
for premature infants.
a federal program.
早产的婴儿通常都会包括在里面，政府有帮助的。
And Raza also does a very good job of working with the mothers in the unit
他也跟母亲也帮助那个母亲，
to screen for postpartum depression.
也可能会忧郁症，生完之后会有忧郁症，他会看。
Because that can affect what we do for discharge planning and what kind of plans we need to make with the
他们
families.
就搞清楚的母亲有没有忧郁症，对他出院啊，怎么计划出院啊，都会有影响的。
So, are there any questions about this meeting?
有没有问题问他？他为什么？
它是有 key in 在电脑里面嘛，要不然大家都知道。而且 key in 的话是 case manager 在 key in 的。
You can also anticipate home care needs.
他们也会做 home care，应该怎么翻译啊？
家护理，家护理，
家护理，他们也安排。
那是有补助的吗？
One of the things that's unique to this unit, this part of the hospital, is that we have our own team of nurses who care for the patients in the hospital and also do the visits in the homes.
他有一对护士是在这边照顾小孩子，也去家里看那个小孩子。
是一样的人呀。
The same nurse
Yes.
care here and then go home to the home.
Yes.
A few selected nurses.
就是有几个是这样的，在这边照顾，就回家照顾。
They're specially trained, right?
Right.
Yeah.
他特别的
So they work with our home care department,
所以他是 home care 方面。
and they've done all the training for home care, but they do all the care in the neonatal unit as well.
他两边都有
So
学习。
they might spend 2 days of the week working in the intensive care here, and 2 days a week seeing patients at home.
他工作时间的分配就是可能2天在这边医院，2天在家，病人的家。
But this way we're able to provide a bridge for families transitioning from the intensive care unit to the home.
这样子的可以帮助那个家庭，比小孩子刚回家的之间这段时间。
When some of our babies go home with multiple medications, multiple physician appointments, they need therapy in the home. It's very challenging for families to learn that care at home for their child.
有些小孩子啊，有很多药，有很多护理要做，所以一下子回家，对那些家庭来讲是蛮困难的。
So the nurse spends a lot of time teaching the family how to really learn how to be the baby's case manager after discharge.
所以那个护士是花很多时间的教导那个家人怎么照顾那个孩子在家里。
Because some of these children they'll have lifelong problems that the family needs to learn to take care of.
这些小孩子可能一生人都有很长的时间都有问题的，所以家人要学习怎么去照顾他。
That's the discharge planning piece.
那个就是回家方面的计划。
I put some posters up here because one of the other things that I do as case manager is try to help with the quality improvement piece and try to streamline processes in the neonatal intensive care unit.
他其中一个工作就是最好做得更好的工作。
So the nurses looked at the research regarding retinopathy of prematurity.
所以护士看那个研究那个小孩子这方面的。
And they noticed that some of the newer protocols were based on babies' oxygen saturation ranges.
有一个草案就是小孩子的氧气方面的问题。
According to gestational age.
就是那个小孩子很小的时候。
And so since we looked at the national data for what babies should, what percentage of eye disease there should be in the neonatal intensive care unit.
他看看整个美国在这个小孩子那个这边眼科方面的问题。
And we compared the rate that we had.
比较我们这个医院的。
We realized that our babies needed surgery for this eye disease a lot more than the national norm.
他看到这边好像很多小孩子之后都要开刀的眼。
So for us, this is an opportunity for improvement.
所以呢，他们只有改进咯。
So with the nurses, we worked out a way to audit and keep track of where we were keeping our oxygen saturation ranges.
所以他护士就小心这些小孩子应该给多少氧气。
And this is a process that took us many months.
那个过程用了很多个月。
First, we had to do a lot of education for the staff.
所以首先我们要教育那些护士，很多教育。
And then we had to see how compliant we were.
我们做的怎么样？做得好吗？有没有做的跟着来做？
And then finally we wanted to see the outcome.
结果了，最后。
And we hoped that it would be less eye surgery.
希望是会减低那个开刀。
And we did indeed cut our rate of eye surgery in the unit in half.
他们结果是减小了很多眼睛开刀了。
So it's looking at things that seem to what we try and do is see what kind of processes we have in the unit and try and streamline that so that it's better outcome for the patient, but it's also more cost effective for the institution.
他的工作就是看看这个过程可以怎么做的最好呢？另外一方面也可以减低费用也好。
Because for the baby, they have better eyesight.
孩子来讲，他眼睛会好一点。
There's no pain from surgery.
开刀会痛的，所以不用开刀不会痛啊。
But for the institution, they don't stay in the hospital as long.
for 医院来讲，他不会留得这么久。
And there's not the added expense of surgery.
不用开刀的少付钱。
So that's pretty much what we try to do here in the NICU.
他主要是这样子，常这样做。
Would you like to go on a tour of the unit?
要不要看看外面？小孩子有个医院，要把起来了，做什么
？Can you introduce this?
我们看。
Yeah. This is another. This we did in probably 5 or 6 years ago.